Welcome back to Your Own Health Tech, and we have Kirsten. Kirsten, please introduce yourself.
Sure. I'm Kirsten Karchmer. I was one of the first board-certified reproductive acupuncturists in North America, and now I'm building the first operating system for women's health.
That's awesome. So tell me about yourself and tell me about Conceivable.
Sure. Well, I was a linguist first, and then I got diagnosed with MS. And during that time, I ended up going to an acupuncturist. And the work that I did with that acupuncturist, I ended up going into remission for about 30 years. And what I learned from that experience was the importance of, like in Chinese medicine, they always say you're never treating anything, you're always treating everything.
Yes.
So this approach to working with women's health and fertility by looking at the whole picture as opposed to symptom-specific interventions. And Conceivable, like I said, starting with infertility, we're building like an operating system for women's health that is basically a virtual care team. So women will do an assessment. They'll collect about 50 data points to figure out what the underlying issues are, and then get a virtual care team with a therapist, a nutritionist, tongue analyzer, because it actually can take a picture of it and it gets your tongue analyzed, and Kirsten AI is me, to figure out those underlying issues. And then it drives very, very personalized programming. We have a wearable that's a non-invasive glucose monitor, it takes temperature and things like that. And we do personalized supplements as part of those interventions.
Wow. So diagnosing MS using acupuncture and putting into remission for 30 years is absolutely great. That's awesome. What have you found through acupuncture helped you other than your medical needs? What kind of benefits did you receive?
Well, acupuncture is really good again because whatever your problem is, whether you have diabetes or MS or heart disease or back pain or whatever, outside of pain, a good acupuncturist should be working with the person to help figure out the underlying issue. So it can be really beneficial for any chronic illness, because you're not treating the chronic illness, you're treating what are the symptoms and behavioral and environmental factors that are contributing to that presentation, and then how do we systematically improve that. Like in the fertility section, women using the app, we had 105 women in the pilot. Those women increased the likelihood of natural conception by between 150 up to 260% in 4 months or less with no human interaction.
Wow. How does that differ from Western medicine? What what is what I mean that's amazing in itself, right? My mom adopted me because she was infertile, and back in the 1960s and late early 70s, there wasn't really anything there for that. So obviously, the next best thing is for adoption.
Yeah.
Thankfully, I'm grateful for my mom. What can people do to reach you to investigate those possibilities?
And what you can do is you can definitely visit us at the website conceivable.com. You
What?
can go to TikTok, your yeah, your fertility expert.
Okay. Wow. What kind of things are coming out in the medical field today alongside acupuncture and Western medicine that allows fertility to grow that exponentially? That's an awesome stat that people can become pregnant through alternative means other than the traditional means that we already have. Do you want me to
I
restate?
would say it's basically what we're doing is restorative reproductive medicine, right? We're identifying what are those underlying factors that are not necessarily causes of infertility, but those factors that are associated with lower fertility, like scantier bleeding, longer cycles, poorly timed ovulation, exhaustion, and a whole bunch of other things, diet related, environmentally related. And so identifying those and then repairing and restoring those, you have this natural side effect of improved fertility
Oh,
and
wow.
health.
Okay. So what could women do dieting wise to increase that? Is there something that we shouldn't be eating? Is there something that we should be eating?
So you should not be a vegan, for one. Women who have a vegan diet are 50 or more percent less likely to get pregnant than omnivores. Start with a Mediterranean diet is going to be pretty safe for most people. We think we can do much better in the Conceivable app. After you've done your consultation, we just make your menu plans for you. So exactly, instead of following like Mediterranean diet, we basically make a diet specifically for you, and then we see how your body responds to that. And then each month we can recalibrate those nutritional plans to make sure that we're getting consistent and continual progress.
Is there anything men can do, either diet wise or other things to help the women to become pregnant?
Well, again, instead of, the thing that I hate are sort of tips, because
Hmm.
tips are what lead women. They'll hear 1,000 tips and then they're doing 1,000 things, and maybe only 3 or 4 of those tips are applicable to them. Like the high level things are like you need a lot of sleep to be optimally fertile, like 8 or 9 hours a night consistently. You need to nourish yourself. You need to be able to digest food. So gas and bloating, we need to resolve that because we need to be able to take the food that we're eating, even if it's perfect food, break it down, convert it into resources for making hormones, for making blood, for making energy. Track your period with basal body temperature charting. Don't use monitors. Monitors are just a scam. You don't need to predict ovulation. You want to get to have a 28 to 32 day cycle. And if you don't, we need to fix that so that you do.
Oh, wow. So how does acupuncture fit into this? I'm really surprised acupuncture helped.
Well, remember that acupuncture, this is where a lot of people get confused because they're like, oh, just sticking needles in you fixed your MS or your fertility or whatever. And really, like when you go to an acupuncturist, you're actually going to a doctor of traditional Chinese medicine. And so, acupuncture, just like your doctor has a tool called pharmaceuticals or surgeon, an acupuncturist has tools like nutrition therapy, needling, moxibustion, which is burning this stuff that smells like weed all over the place. Um, Chinese herbal medicine therapy, other, regular nutritional supplements, all of those things should work in concert based on the diagnosis. And so really, I always say the skill of the acupuncturist is really, it's less skill with the needle that's important and more skill making an accurate diagnosis, because once the diagnosis is formulated, every other intervention is determined by that.
Oh, so I had CP, so I've been using acupuncture as well for a year, and I've been feeling better with it. So, what has your experience been using acupuncture? How long has it been lasting for you afterwards if you continue to use acupuncture?
Well, I mean, I give myself acupuncture, right? Because I can just do it myself. So but the thing is you shouldn't be relying on the acupuncture treatment to last longer. What you want to do is like in our pilot, the acupuncture, like the app actually beat me. So we had 105 women using the app and 105 women getting acupuncture. And there was a 5 or 6% improvement. The app got people pregnant faster than I did. And the reason is not because acupuncture is not beneficial, but like what you just asked me, like, well, how long does the treatment last? You want to, your acupuncturist needs to determine what is the underlying reasons for the symptoms that you're having. And you should be getting diet suggestions, Chinese herbal medicine suggestions, lifestyle suggestions. And that's what you do to make the treatments last longer and to make the treatments go faster. Like you can spend a lot less money at your acupuncturist if you're doing the work at home consistently every single day. That makes the work of your acupuncturist very clear and very straightforward. And if you're not, you're going to just go to acupuncture, you're going to get a little bit better, and then you're going to go back and get worse because your life is going to go back to how you used to be living that caused the symptoms in the first place.
Gotcha. So, wow. I'm at lots of questions here. I'm really interested on how long your app's been and what kind of results you've seen.
Okay, well, maybe we covered them all.
What kind of things do you see in the future for Conceivable?
So we're just finishing up a new build of the fertility node in the app. And then we have a whole suite of experiences. They won't be individual apps because they'll be in that same app, but from girls' first period all the way through pregnancy, postpartum, perimenopause, menopause, postmenopause. Essentially, we'll build experiences to support women in their health from age 7 until death.